Welcome to Module 7 of the National School Mental Health Curriculum, Funding and Sustainability. I'm Nancy Lever, and I co-direct the National Center for School Mental Health at the University of Maryland School of Medicine. Module content was developed by the National Center for School Mental Health in partnership with the Mental Health Technology Transfer Center Network. The opinions expressed herein are the views of the Mental Health Technology Transfer Center Network and the National Center for School Mental Health and do not reflect the official position of the Department of Health and Human Services, SAMHSA. No official support or endorsement of DHHS SAMHSA for the opinions described in this document is intended or should be inferred. All the material in this presentation is available in the public domain and can be cited using this citation. In this module, we will review the definition of school mental health funding and sustainability and opportunities to secure and leverage diverse funding sources and to sustain successful school mental health systems. We will review quality indicators and best practices for the funding and sustainability domain, and then we'll discuss district strategy planning. What do we mean by school mental health funding and sustainability? School mental health funding and sustainability refers to the strategies to optimize financial and non-financial assets needed to maintain and improve your school mental health system over time. Sustainability is always evolving, but the goal is to ensure that your operational structures and capacity are sound and that your system can grow and adapt to match the changing needs of your students, families, schools, communities, and other systems. This is a list of the quality indicators for the funding and sustainability domain. For each of these indicators, we will discuss best practices, resources, and helpful tips. The first quality indicator to consider is to what extent did your district or school use multiple and diverse funding and resources to support a full continuum of school mental health services and supports. Having multiple and diverse funding and resources to support a full continuum of school mental health services and supports is essential for building and sustaining high-quality school mental health systems. Best practice for this indicator includes using multiple and diverse funding sources from different levels, such as the school, local, district, state, and federal funding, having different types of funding, such as grants, third-party reimbursement, cost sharing, private foundation funding or block grants, and different systems such as education, physical, mental, and public health, as well as substance use. It is also important to ensure that your funding and resources align to support a broad and full array of services and supports for each of the tiers, such that there is adequate funding to support services and supports for each tier. To maximize funding for your school mental health system, it is helpful to explore funding from diverse sources, all the way from school funding to federal funding, both public and private. Some examples of funding include school-level funding, such as principal discretionary dollars, funding from the PTA, and private donations, local-level funding, including general revenue, categorical revenue, taxes, and from community businesses, state-level funding, including block grant programs to develop school behavioral health infrastructure, the Children's Health Insurance Program, state health initiatives and taxes, and federal funding, including block grants, project grants, legislative earmarks, direct payments, and finally, private foundation grants, which include pilot projects, behavioral health prevention, and/or promotion activities that can be funded through private foundations or donors. Developing a financing plan can guide the team's funding and sustainability efforts. This self-assessment and planning guide, developed by the Research and Training Center for Children's Mental Health, offers practical strategies and tools to help a team to develop a comprehensive financing plan. The self-assessment and planning guide, Developing a Comprehensive Financing Plan, addresses 7 important areas to assist systems and sites to develop comprehensive and strategic financing plans for building effective systems of care. These 7 core areas include identification of current spending and utilization patterns across agencies, realignment of funding streams and structures, financing of appropriate services and supports, financing to support family and youth partnerships, financing to improve cultural linguistic competence and reduce disproportionality in care, financing to improve the workforce and provider network for behavioral health services for children and families, and financing for accountability. Here is a district example of how one large urban district in Maryland was able to leverage funding from education, mental health, private foundations, and fee-for-service to collectively support community-partnered school mental health. As part of this system, 55% of funds are secured through fee-for-service reimbursement, 35% through mental health and education funds at the district level, and 10% from foundations and other grants. This Pennsylvania state example illustrates how one state with a long history of success in advancing comprehensive school mental health at the state and district levels has used braided funding to help support its school mental health services and supports. Funding to support their system has come from fee-for-service revenue, mental health and substance use allocations, education training funding, and drug and alcohol funding to counties to support prevention efforts. Now I would like to share several outstanding school mental health funding examples from the Southeast region. This slide details two funding examples from Alabama. The first example demonstrates how state resources can be used to create a new position in the mental health workforce. In 2020, the Alabama State Legislature allocated $4.5 million in grants for local education agencies to employ school-based mental health service coordinators. School-based mental health service coordinators can have a variety of prior experience in health or mental health, such as having a bachelor's degree in social work or related field, qualifications for a school counselor or school nurse, or prior professional mental health experience. In their first year, the coordinators will be required to complete a needs assessment and resource map of school mental health services for all schools in their jurisdiction. They will also provide coordination and support of all student mental health services, including tiers 1, 2, and 3 throughout the school districts. The next example is about workforce expansion. 7 years ago, the Alabama Departments of Mental Health and Education developed a proactive collaborative partnership funded with local dollars to place master's level clinicians in public schools. In this case, local dollars means existing funds from local community mental health centers and local education agencies were reallocated to fund these positions. In fiscal year 2019 to 2021, the governor and the Alabama legislature appropriated $1.75 million to expand this workforce. There are now 72 school systems served by 151 school-based mental health providers through this initiative. Of the 72 school systems, 51 were able to initiate with local funds and 21 started with additional state funds. This example from Kentucky illustrates how state-level funding can be allocated to expand specific parts of the school mental health workforce. In Kentucky, a law was passed that allocated $7.4 million to fund additional school-based mental health providers. These funds fulfill Kentucky's commitment to have one or more school counselors in every public school statewide, each committed to providing direct student services with at least 60% of their time and at least one counselor or school-based mental health provider for every 250 students. All 171 school districts are now receiving support through this allocation. In this example from Tennessee, $3 million in recurring state funding was allocated to support staff positions called school-based behavioral health liaisons. The funds bring master's level clinicians to the 59 remaining counties in the state that did not previously have such a position funded. These liaisons help coordinate and support comprehensive school mental health services by first, helping schools conduct needs assessments of school behavioral health needs. Second, providing training, education, and support to school personnel on topics related to behavioral health and trauma-informed approaches. Third, implementing Tier 1, Tier 2, and Tier 3 services. And fourth, fostering positive relationships between families and schools. Let's take a moment to reflect. In your district, which funding sources are currently being accessed to support school mental health and which remain to be explored? Funding sources to consider include federal funding sources, non-federal public funds, as well as private funds. General education funding has often been overlooked by school districts when searching for sources of support for prevention. This guide, developed by the Center for Health and Healthcare in Schools at the George Washington University Milken School of Public Health, is intended to help districts take advantage of those funds by identifying K-12 grant programs in the U.S. Department of Education that could be used to implement prevention efforts in elementary and secondary schools. This issue brief, developed by the Now is the Time Technical Assistance Center, provides schools, districts, and education agencies with strategies to access and utilize these funds to support mental health services in schools. The next quality indicator to consider is to what extent did your district or school leverage funding and resources to attract potential contributors. To adequately support a comprehensive school mental health system, it is beneficial to leverage resources to attract potential contributors. Best practices for this indicator include establish and use a formal agreement that specifies contingent funding and/or non-financial resources. Regularly seek potential partners who may have funding or non-financial resources that can be contributed to support the larger school mental health system. And establish and foster relationships with diverse agencies and organizations in the community with the goal to create more opportunities to leverage funding and resources. Some helpful tips for leveraging funding resources include conducting a comprehensive scan of existing funding opportunities, establishing partnerships with community mental health programs and other agencies and organizations to expand available services, resources, and infrastructure, developing an MOU or Memorandum of Understanding that documents agreed upon services, and thinking beyond dollars and consider exchanging services, training, or resources. Let's take a moment to reflect. What ideas does your district have to expand potential funding partners? Identify 3 potential allies in your state or community who are likely to share some of the same ideas as your comprehensive school mental health system initiative. Think of at least 2 potential investors in the expansion and sustainability of your initiative who have not been engaged before. Another indicator to consider is to what extent did your district or school have strategies in place to retain staff? Retention of staff is important for student, family, and school staff relationships and trust and is cost-effective. Hiring and training new staff is time-consuming and quite costly. Best practices for this indicator include providing in-person and virtual ongoing professional development activities such as lectures, didactic presentations, and peer consultation, regularly recognize and celebrate accomplishments and personal milestones, practice open, bidirectional communication and provide opportunities for staff to provide anonymous input if desired, offer flexible work schedules, provide and evaluate staff wellness activities, engage staff to provide input on how to optimize staff retention, provide supervision and opportunities for peer support, provide opportunities for career advancement, provide incentive-based paid, and also work to ensure that salary is fair and there are opportunities for growth. This example illustrates how one community-partnered school mental health program in an urban district in Maryland has been able to successfully retain staff for an average of over 6 years through integrating federal loan forgiveness programs for providers in underserved settings, beyond just individual staff self-care, it's important to consider broader organizational factors that contribute to staff well-being and reduce burnout. Using this assessment or one like it can inform action steps or quality improvement goals intended to improve staff retention. The organizational self-care checklist considers 5 categories: training and education, support and supervision, employee control and input, communication, and work environment. Sample items included on the checklist are included on the slide. The next indicator to consider is to what extent did your district or school maximize the expertise and resources of all stakeholder groups to support ongoing professional development activities. Ongoing professional development is critical for staff to be able to perform at the highest level of functioning. The expertise and resources of all stakeholder groups should be used to maximize professional development activities. Best practices for this indicator include polling school staff members, community providers, students, and caregivers about their expertise, offering professional development activities that use the diverse knowledge and skills of stakeholder groups, training school and community employed mental health providers together, engaging youth and family leaders and advocates in professional development as trainers and learners, and using diverse professional development mechanisms, such as in-person and virtual lectures, consultation, coaching, mentoring, and written resources. Here are some helpful hints on how to maximize the training expertise of all partners. Examples include community mental health providers training teachers on the identification of mental health problems, school psychologists training community mental health providers on school language and policies, youth and family members training school-based mental health providers on effective ways to engage and support student mental health, and training school staff as trainers of an evidence-based mental health practice to train the larger community mental health workforce. Another quality indicator to consider is to what extent did your district or school have funding and resources to support Tier 1, mental health promotion services, Tier 2, early intervention services, or Tier 3, treatment services. It is important to have funding for services and supports within each tier of a multi-tiered system of support. Consider to what extent did your school maximize reimbursement opportunities for eligible services. Maximizing opportunities to be reimbursed for services is a necessary component in building a sustainable school mental health system. Let's take a moment to reflect. Is your state optimizing Medicaid and private insurance to support school mental health? Questions to consider. Who can bill for school-based services in your state? What services are billable? Are there services that are billable and are not being billed? Are there services that your state would like to consider adding to billable services? And what other obstacles to reimbursement exist? There are 5 dimensions that can be explored within Medicaid to better support school mental health. These include, first, maximize enrollment of eligible children by assisting with enrollment in Medicaid and the Children's Mental Health Insurance Program. Expand covered services and supports to include, for example, teacher consultation, parent support, case management, and prevention approaches. Create new provider types to include, for example, parent support partners and graduate trainees. Use cross-system strategies to optimize funding. For example, school mental health can be supported with braided or blended funding, or a case rate model can be used using multiple child-serving systems, including education, mental health, child welfare, juvenile justice, and developmental disabilities. It's also important to improve reimbursement methods to include fee-for-service, prepaid capitation, and case rates. Early and periodic screening, diagnostic, and treatment, EPSDT, is the child health component of Medicaid. Children under the age of 21 enrolled in Medicaid are entitled to prevention and treatment services. Find out how well EPSDT is accessed in your state for universal screenings, early identification of mental health risk. Take steps for your school or district to become a direct Medicaid provider. Make a plan to identify and continuously monitor your own state's Medicaid plan and waivers. What other states are requesting or receiving Center for Medicare and Medicaid Services approval for? Look to federal guidance to states about effective ways to use Medicaid coverage. Consider public education policy initiatives and useful websites, groups, and resources, including Kaiser Family Foundation and the Center for Healthcare Strategies Incorporated. There are numerous innovations in states to fund school mental health services. Examples from 6 states are highlighted below. including Alabama's Department of Education and Mental Health, developing cross-system funding to support school mental health programming, Arkansas's Department of Social Services, changing the social work job description to provide care coordination services in schools for all students with a response to intervention for behavioral health plan, and state-level partnerships among the Department of Education, Mental Health, and Juvenile Justice to provide shared funding for Tier 2 and 3 services in the schools. In California, the Mental Health Services Act, funded through additional tax and local ownership of school mental health program development to fit local needs. In Michigan, the IDEA Medicaid revised to include Tiers 2 and 3 mental health counseling sessions by school professionals. In South Carolina, the Department of Education developed a psychosocial behavioral health rehab Medicaid standard for school social workers, psychologists, and licensed counselors for Tier 2 and 3 treatment. The state developed a recurring line item in the state budget to ensure funding for rural communities to develop school mental health programs. And in Tennessee, school mental health funding provided for case managers in schools for Tier 2 and 3 services. Let's take a moment to reflect. What policies are in place or should be in place to sustain school mental health in your state or district? Questions to consider. What policies are currently helping to support school mental health efforts? What policies need to be in place? And who are your advocates and policy champions? These are all important questions. Influencing policy related to supporting school mental health can be a heavy lift, but can yield significant results. Working with key knowledge leaders and advocates can help inform the most effective policy to influence school mental health in your state. One exemplar for state policy to advance school mental health services and supports is the state of Nevada. As part of the National Center for School Mental Health National Quality Initiative, virtual training sessions and resources were developed in collaboration with the American Institutes for Research to help districts to develop a strategic financing and sustainability plan. The 5-step process can help districts better understand and plan for sustainability of school mental health. The process is intended to be circular as a part of a continuous improvement process. The 5 steps include: 1. Clarify what you will need by when. 2. Map current funding and resources. 3. Determine gaps in needs versus existing resources. 4. Select financing strategies and funding sources. And 5, make and execute a financing action plan. Tools to support the strategic financing and sustainability plan are found on the next few slides and in the resources section. This resource offers a guide for planning future costs in categories and over time. First, you will need to clarify what you will need and by when. You will need to consider what you need to pay for, including services and supports, workforce development, consultation, technical assistance, CQI processes, etc. This resource, the Funding Resource Mapping Worksheet, helps to map current funding, including source and amount of funds, funding restrictions, and time frame of funding availability. The Funding Gap Analysis Worksheet can be used to help teams assess the current costs of their school mental health system, available resources, and gaps in funding over multiple years. Next, we determine gaps between needs versus existing resources. What is the gap between current spending and projected fiscal needs? By services and supports, by subpopulations, by strategy or activity, or by fiscal year. This document, Developing a Business Plan for Sustaining School Mental Health Services, was developed by the Center for Health and Healthcare in Schools at the George Washington University Milken School of Public Health to describe different models of financing school mental health services. Specifically, the document describes how 3 communities and their lead mental health agencies have worked with schools and other local and state agencies to develop sustainable programs. As a next step, you can bring this content back to your district and begin strategic planning, which includes creating specific goals and action steps for comprehensive school mental health. This module was supported by the work and research of many others, which are also available as resources. Here is a list of references for this module. Lastly, we would like to note that this work was supported through a SAMHSA grant and developed through a partnership between the National Center for School Mental Health and the MHTTC Network Coordinating Office.